Hello, YouTube friends. It's Maria Trusa, the CEO of Fort May Medical Center. I am here today to talk about poison ivy. So poison ivy, we decided to really pick that topic today because we are seeing in the urgent care, we're seeing many patients that are coming in with poison ivy. And I invited today our nurse practitioner that works at the urgent care, Raquel. How are you, Raquel?
Hi, I'm good. Thank you.
So Raquel and I are going to be talking about poison ivy. And my first question to you, Raquel, so you're seeing a lot of cases that are coming to the urgent care, right?
Yes.
And what are the symptoms of poison ivy?
So basically, the symptoms of poison ivy when you come in contact with the plant, first of all, it's identifying what poison ivy is. So poison ivy, you can see it when you're hiking in the outdoors, you're gardening. Basically, it's just identifying if you see this type of plant, you just want to stay away. The way you identify this plant is just, you would see just a tall plant with 3 leaves. These 3 leaves, you would have you identify it by a large leaf in the center and then 2 on the sides. They can be reddish green in color. If you see this type of plant, just stay away. If you see 3, just let it be.
And where do you usually find these leaves?
For the most part, they grow along with the weeds when you're gardening. You can see it when you're hiking. A lot of outdoors activities now in the summertime. You can see them a lot.
So this could technically be in your house, right? In the backyard of your house.
Yeah, in the backyard. So basically, if you see this leaf, or some people just maybe not know how to identify the leaf, or if you do come in contact with the leaf, the symptoms is actually a reddish rash that you would get on your arm. And the only way to get this rash is by coming in contact with the oil on the leaf. So the oil on the leaf is called Urish oil. So you would get this oil on your arm or any part of your extremity, and then that's the only way you can get the rash.
So the rash that you get, is it like a rash that is on fire? Is it really aggressive?
So when you first come in contact with the oil, you won't get the rash immediately. It can actually take a couple days or up to a week to get the rash. The rash the way it's identified is actually a vesicular rash. So it would be fluid-filled reddish rash. So, you can, for the most part, the most popular areas where you can get this rash is actually in the arm and in your legs, because you're coming across this leaf. So that's the way. So, you would be in the backyard one day, and then the next day you will probably start feeling some burning and itching. And then, if you don't get it treated right away, or you're not able to identify it right away, then it starts getting worse over the days.
And what's the treatment for it?
So initially, if you do feel like you've been in contact with poison ivy, immediately that day you go home, you take some soap and water, and you just wash off your extremity immediately, or you can take alcohol and just try to take that oil off. Sometimes that works, but sometimes it doesn't. If it doesn't work, you can always go to the pharmacy and get over-the-counter cortisone cream, which is just 1% hydrocortisone, and put it on and see if that works. But if you feel like if those treatments did not work immediately, you can just come to the urgent care or see your primary care doctor, because sometimes you would need systemic or oral steroids, anti-inflammatories, to decrease those symptoms.
Wow. So I think we gave you a lot of information about poison ivy today, but if you find that you have these symptoms, remember that we are here for you. We are open every day, and on the weekends, during the week, we are open until 9 o'clock. I thank you so much for listening, and I look forward to speaking with you next week again. Take care. Bye-bye.